Hey y'all, today's video is about pelvic floor PT, specifically as it relates to people who are intersex. I was motivated to make this video yesterday when I gave a guest lecture, and I was reminded once again how often intersex people are just left out of the conversation entirely when it comes to LGBTQ plus issues, and that unfortunately includes healthcare. So for those of you who aren't familiar with what intersex is, a very basic definition is these are people who have aspects of both stereotypical male and female anatomy. So what I mean by that is if you think back to middle school biology class, right, we're taught that on one side of the binary we have XX chromosomes with a vulva and estrogen, and that means female. And then XY chromosomes with the phallus and testosterone is male. But it's really not that simple. And while in some parts of the world it's becoming more common to recognize that gender is more of a spectrum rather than these two distinct checkboxes that have no overlap, it's less common still to think of sex that way, biological sex. So there are really myriad ways that someone can be intersex. For example, there's something called Klinefelter syndrome, where someone is born with XXY chromosomes. They have an extra chromosome. There's a lot of other presentations. Its hallmark is usually something called, and I'm not a fan of this term, ambiguous genitalia. So it doesn't look by what you would typically expect to see based on those two binaries that I mentioned. But intersex folks are actually not that uncommon. So they're estimated to make up roughly 1 in 200 people, which is the same percentage of the population that accounts for natural redheads. Fun fact. But there's a lot of different ways that intersex people experience medical oppression and harm. And I could probably make a whole video just about the various unnecessary surgeries for these people. But today I want to talk about a specific type of intersex presentation and a specific intervention for that. So today I'm speaking about the folks who are born with a vulva, but they don't have a uterus and they don't have a cervix. These people often have XY chromosomes, so what are typically thought of as male chromosomes. But their bodies don't respond to androgens like testosterone. So they have something called androgen insensitivity syndrome, and that also is on the spectrum. Sometimes they're only a little bit insensitive, sometimes they don't respond whatsoever to these types of hormones. So they have often internal testes rather than ovaries, but they don't have external male genitalia. So for all intents and purposes, you might look at this person externally and have no idea that they're intersex, because they can grow breasts, their hips can get wider, they can respond to estrogen, but maybe not androgen, like testosterone again. So these folks, because they don't have the upper part of the vaginal canal, the cervix and the uterus, sometimes the vaginal canal on these folks is quite a bit shorter. And unfortunately, surgeons do sometimes pressure these intersex people or the parents of intersex children to have the child undergo what's called a vaginoplasty. So you might have heard of a vaginoplasty. It's seen more commonly in society as a bottom surgery or gender affirmation surgery for trans feminine folks. And the purpose of this is usually to create an entirely new vagina, but it can also be done in cisgender women and also in intersex people, with the purpose of expanding the tissue to accommodate penetration. But and some people really like the surgery, right? They have good responses and they're happy with the outcome, and that's great. And anybody should be empowered to make informed medical decisions about their own body. But the sad reality is that sometimes this, which is quite an invasive option, is the first thing that's offered, and it's not until repeated refusal are patients offered an alternative that's more conservative. So that alternative is something called dilation. And I want to talk about that because this is very relevant to pelvic floor PT. So this is a dilator. It's usually made out of medical grade silicone or plastic. I also put some pictures of a dilator on the first slide of this video. They often come in like a graded set. Some of them start as small as my pinky finger. And the cool thing about this is that vaginal tissues expand. So when you're in an unaroused state, very similar to a flaccid penis, the vaginal tissues kind of collapse or shrink in on one another. They get quite small, but then in an aroused state, they expand, especially when pressure is applied to the sides of the vaginal canal, such as during penetration or when like a baby is descending down the canal. So I have used vaginal dilators on many folks, including cisgender women who have pain with sex or a condition called vaginismus, which is where the pelvic floor muscles involuntarily contract and don't allow for penetration, and it makes it usually quite painful. And the trans feminine folks I mentioned earlier who undergo vaginoplasty are almost always recommended to undergo dilator training because they need to create expansion of this new tissue so that it's functional for sexual purposes. And this is also true for people who are intersex. So the way that dilators work, and I'm not going to lie, it can be quite painful, which is why it's very useful to have a professional help guide you through it, because we don't want to start associating the brain with this area we don't want it to start to learn that it's a form of pain and a stimulus of pain rather than pleasure. But you can start very, very small with these dilators, and you can slowly expand the tissue, kind of like stretching a muscle, and actually increase its mobility and your tolerance for penetration. And while it does take more time and it's not as immediate as a vaginoplasty, it's far less invasive. It has far fewer side effects. And it's something that the thing I love about it most is that the patient gets to take an active role and they can feel empowered. They're doing something for their bodies and for their own pleasure. So yeah, if you weren't familiar with that, please share this video. So look up dilators. They're really interesting. Like I said, they look a little bit kind of like a dildo. Some of them even vibrate, but they're easily purchased online. Again, I would recommend at least having an evaluation with a professional to know where to start and have the guidance. But yes, I just thought I would share that information with you all, that there are alternatives to vaginoplasty for intersex people. Please let me know if you thought this was interesting or helpful. I'm looking forward to making more videos about this topic in the future. Thanks for listening.